Hi everybody and welcome to our educational session where we teach you how to use ultrasound to identify long bone fractures. Thank you for being here today. Ultrasound has several advantages as an imaging modality. For one, it is much less expensive than many other imaging modalities. It is also portable and available at the bedside, which is especially useful in patients who may be too unstable for transport out of the department for a CT or MRI. Unlike modalities such as CT and X-ray, ultrasound does not cause ionizing radiation, which is especially desirable in kids and pregnant women. Finally, many low-resource settings may have access to ultrasound but not X-ray, making it a versatile skill in this environment. Ultrasound works to convert sound waves into images. Each ultrasound probe contains crystals with piezoelectric properties. This means that when electricity is applied, they vibrate and produce ultrasound waves that travel into tissue and are reflected back at varying times and intensities. They then hit the probe and create electrical current, which gets processed to form the image on the screen. Echogenicity refers to the extent to which a structure gives rise to reflections of ultrasonic waves. An anechoic image is one that is completely black. Hypoechoic refers to structures that appear relatively darker, such as fluids, urine, bile, or blood. Hyperechoic refers to structures that appear relatively bright white, such as bone and gas. Organ, parenchyma, and soft tissues are intermediate, but each differs slightly from the other and relative characteristics are known. Imagine the ultrasound probe as viewing a slice of what's underneath it. In the diagram on this slide, image A shows the ultrasound probe in relation to a solid organ beneath it. Image B shows the cross-section of the organ that would appear on the screen. Image C is a real image demonstrating an ultrasound view of the hepatic vein. By turning the ultrasound probe, one can view different axes of the structures beneath. For instance, a cross-sectional view if the probe is perpendicular to the long axis of the structure, or a longitudinal view if the probe is parallel to the long axis of the structure. There are several different types of probes that operate at different frequencies and thus can be used to visualize different structures with varying efficacy. Depth and resolution both depend on frequency. The higher the frequency, the more superficial and more detailed the image. The lower the frequency, the deeper and less detailed the image. This is why we use the high-frequency linear probe to visualize more superficial structures. The low-frequency curvilinear abdominal probe has a larger footprint, or portion that contacts the body. This probe has a wide field of view and a low frequency that is good for deep structures like the abdomen. It's often used for the FAST exam to detect blood or fluid in the abdomen after trauma. The high-frequency linear vascular probe, also called the linear probe, produces a rectangular image. It sacrifices depth penetration for better resolution. Thus, it is good for visualizing more superficial structures like vessels. It's good for obtaining vascular access and ocular and lung ultrasounds. We will emphasize this probe because it is the best one for visualizing bony fractures. The phased array probe, also known as the cardiac probe, emits waves from a focal source in an arc that will produce a wedge-shaped image. It has a small footprint and thus is good in echocardiography because it can sneak views in between the ribs.
This is an image of the ultrasound machine we'll be using today. At the upper left, you'll see the on button. On the right, you see an arrow pointing to the high-frequency probe, which we'll use today to try to identify fractures. To select this probe, trace the path of its cord to where it plugs into the machine and turn on the button until the green light illuminates. Next, place gel on both the probe and the patient. An image will appear on the screen. To optimize your images, both depth and gain can be adjusted. The depth buttons, seen here, can be utilized to adjust how deep the images projected on the screen are. The number on the bottom right-hand corner of the screen reflects how many centimeters deep the bottom of the screen is relative to the probe at the top of the screen. The green dots in the center of the screen also help estimate depth. Gain can be thought of as brightness. For our purposes, simply pressing auto gain is often enough to optimally brighten the projected images. The indicator, seen here, corresponds to the dot on the screen. This allows you to orient the directionality of the probe to that of the screen. Always point the indicator, the small dot on the probe, towards either the patient's head or right side. The proper way to hold the ultrasound is demonstrated here, with the probe between the thumb and second and third fingers, with the fourth and fifth fingers resting on the patient to stabilize the probe.
There are three main sections of long bones: the epiphysis or ends, the metaphysis, where the growth plate is located at either end, and the diaphysis or shaft of the bone. The ends of the long bone contain spongy or trabecular bone, while the shaft contains cortical or compact bone. Inside the diaphysis or shaft is the medullary cavity. The medullary cavity does not transmit ultrasound well, so only the compact bone on the side closest to the ultrasound can be seen well. The bone is covered by a thin sheet of periosteum, which contains the pain fibers that get activated in the event of a fracture. Fractures are harder to evaluate at the long ends of long bones, as the growth plate can appear similar to fractures, especially in kids, so we will focus our attention on injuries to the diaphysis. There are several different types of fractures, as you can see here, and today's session will focus on identifying both normal bones as well as transverse, oblique, segmental, and comminuted fractures. Normally, the cortex can be seen as a smooth hyperechoic line. Note the contrast with the hypoechoic dark area deep to it, below it in this image. This is because the ultrasound does not penetrate the cortical bone well. Fractures can be identified as discontinuities in the cortex. In the clinical setting, the presence of fractures may also be indicated by elevation of the periosteum or by effusions or hypoechoic fluid, i.e. blood, which you can see superficial to the bone cortex. It's helpful to begin scanning in the transverse plane. This helps you to orient to the approximate depth of the bone relative to the soft tissue, to identify the plane that the cortex will be running in, and to adjust the depth of your images accordingly. Note that the hyperechoic line in the top center image of the bone, seen here, isn't actually cortex, although it looks similar to cortex. Rather, it represents artifact from the container that the bone is sitting in. After you've identified this rounded image here, which represents the cortex in the transverse plane, rotate the probe 90 degrees to change your view to this longitudinal view, or longitudinal plane. In this plane, scanning the length of the entire bone is much easier, and cortical disruptions, i.e. fractures, are much more apparent. Make sure to scan along the entire length of the bone to evaluate for the presence or absence of fracture. Now, there are several ways in which you can improve the quality of the image you obtain. Often, it's simply a matter of applying more gel. If you do use a sterile probe sheath for the probe, applying gel both inside and outside of it helps to optimize images. Alternatively, you can use a clear adhesive dressing like Tegaderm, which you can apply directly to the dry probe rather than a sheath, and that produces a sterile surface that's a little bit smoother with fewer bubbles of air. For very superficial images, those less than half a centimeter deep, artifact can be a big issue, but you can combat this by either using a standoff pad or a water bath technique. And what this means is a standoff pad is a commercially available gel pad which conducts ultrasound well and can be placed over the skin to create some distance between the probe and area of interest. A half-liter bag of normal saline is an inexpensive substitute since water also conducts ultrasound well. For that reason, water conducting ultrasound well, a water bath technique is also an effective way to eliminate artifact. This involves placing the limb of interest in a tub of water and scanning with the probe just below the surface. An added benefit of using the water bath is that the probe doesn't actually have to be in direct contact with the tender injured area on the patient. To better localize an area of interest, be sure to scan in two different planes. Both the transverse and longitudinal view together will really help you to identify the area of interest. Also, to ensure that the image that you have obtained is a real fracture rather than artifact, it's helpful to look at some of the surrounding tissue as a control of sorts. And you can do this either by looking proximally or distally to the injured area, or alternatively by just looking at the uninjured limb on the opposite side of the body. Finally, in a clinical setting, the physical exam can really be used to guide you in terms of looking at the area of interest. Obviously, the point of maximal tenderness is going to be the area most likely to be fractured, and you can often look for overlying swelling as well.
The image depth is dictated by the frequency of the probe. The high-frequency linear probe is thus best for identifying fractures because it shows superficial structures with high resolution. Orient the indicator of the probe toward either the patient's right side or head. Bone cortex will appear hyperechoic, aka whiter, relative to the intramedullary cavity with ultrasound imaging. Fractures on ultrasound can be identified by cortical disruptions, periosteal elevations, or effusions. Begin scanning in the transverse plane and then rotate 90 degrees into the longitudinal plane. To improve images, apply more gel, adjust depth or gain, or utilize a water bath. These are all the main key points that we want you to take away from today's session. And lastly, here is a list of our references. We hope you enjoyed today's educational activity. Thanks.